Healthcare is both highly regulated and rapidly evolving in the US. In 2022 alone, the Food and Drug Administration approved 37 new medications and 41 devices. However, not all medications, diagnostic tests, interventions, and devices are strictly regulated by the FDA. FDA has historically exercised generous enforcement discretion. To fill the gap of a limited scope of the FDA regulation, health systems have ensured the safety, efficacy, and equity of new innovations through governance process developed by various verticals of healthcare technology. Each vertical is subject to their own governance standards. For example, U.S. Pharmacopoeia develops standards for medication compounding as well as training for pharmacists. Third-party accreditors, such as the Joint Commission, offer certification programs that ensure compounding pharmacists to adhere to the USP standards. The Centers for Medicare and Medicaid Services regulates laboratory testing facilities through Clinical Laboratory Improvement Amendments certification. The Centers for Disease Control and Prevention and professional societies such as the College of American Pathologists provide resources and guidance to support laboratory-directed quality management programs. The Clinical and Laboratory Standards Institute also develops international standards for clinical laboratory testing and offers extensive training for laboratory leaders. When it comes to AI, however, despite its growing use in healthcare, there is currently no clear and established governance ecosystem. Many algorithms are in fact excluded from the definition of medical device and fall outside of FDA's purview. To enhance organizational governance of algorithms and empower healthcare professionals to use AI effectively, safely, and equitably, we launched the Health AI Partnership by recruiting 11 healthcare organizations and 2 ecosystem partners in the United States. Our initial goals were to define usable resources to support health system leaders and examine the current state of practical institutional adoption of AI technology within health systems in the US. First, we collaborated with IDEO.org for a 6-week design sprint to design products and programs that health system leaders would find immediately useful in practice. We recruited health system leaders, representatives from the partner sites, and external AI ethics experts to participate in a series of usability testing sessions. From the usability testing sessions, we created a simple prototype for a shared and objective guideline for AI adoption. The prototype was structured around mock key decision points that align with how organizational leaders approach technology adoption. The design insights and prototype provide a scaffolding for our team to build upon with more rigorous and comprehensive qualitative research. Concurrent with design research, we conducted qualitative research using in-depth interview to understand the current and aspirational state of AI adoption in healthcare organizations. We wanted to identify requirements for the adoption of AI systems in healthcare settings and map out adequate organizational governance structures. We interviewed 89 professionals in healthcare and other relevant fields. Of the 89 participants, 70 were from the partner sites with clinical, technical, operational, and regulatory roles, and 19 were key informants with primary affiliations outside of healthcare organizations. We created an interview guide and asked participants about processes and persons involved in 4 distinct stages of AI adoptions. All interviews were transcribed and organized through 2 cycles of coding process. The first cycle of coding captured the general ideas that emerged from the raw data. The second cycle of coding examined the most frequent and significant codes and categorized the initial codes based on thematic similarity. After the second cycle of coding, we've identified the most prevalent themes and sub-themes using the key decision point framework created from the design research. Major themes emerged as important factors that shaped decisions related to adopting AI product. The factors were grouped into 8 key decision points across the entire process of adopting AI. The results identified challenges and risks that organizations experience in the process of AI adoption, as well as real-world processes and practices. The first decision point describes how organizations identify a high-priority problem and consider adopting AI product to solve the problem. The second decision point describes how organizations conduct an initial evaluation to examine whether the adoption of the AI product is feasible. During this initial evaluation, they estimate the cost of the investment, identify required resources, conduct preliminary quality assurance of the AI product, and seek alignment among affected parties. After the evaluation, they determine whether they build or buy the AI product. The third decision point describes how organizations set their goals and define measurable outcomes along technical and socio-technical dimensions. The fourth decision point describes how organizations develop workflows and user experience surrounding AI product to facilitate its adoption into clinical care. The fifth decision point describes how organizations conduct a comprehensive review of data and evaluate the AI product to validate that technology meets user and organization requirements. After this evaluation, organizations decide to clinically integrate or abandon the AI product. The sixth decision point describes how organizations provide necessary communication, education, and support to frontline workers to adopt the solution and ensure success to achieve desired outcomes. The seventh decision point describes how organizations monitor the technical, operational, organizational, and relational aspects of the AI product and work environment to ensure that it continues to function appropriately. The last decision point describes how organizations may make improvements to the AI product and work environment or decide to terminate use of the AI product. While there is no explicit shared and comprehensive set of best practices of AI adoption in healthcare, our interview surfaced a set of common practices that health systems already engage in. Our interviews reveal that health systems understand AI product as part of a socio-technical system that involves the humans, the policy environment, and the practical considerations of clinical care, and they try to work with interdisciplinary teams of clinicians, technical experts, and data scientists. We found that health systems develop documentation and explanatory artifacts of the AI product and data to build clinician trust while respecting their agency and expertise. We also found that health systems understand that AI governance requires new resources and expertise beyond current capabilities of health systems. Health systems are in need of shared standards to governing the AI adoption process. The absence of shared standards not only creates social and economic costs on individual health systems, but also impedes safe and effective AI adoption. Our 8 key decision points shared among many health systems can serve as an initial use case for developing shared standards for AI adoption. We hope that our multi-organizational effort can help health systems make informed decisions around adopting emerging technologies. To learn more about how to adopt AI in healthcare through community-informed, up-to-date standards and engage with other peers, check out our website, healthaipartnership.org. Thanks for watching.